Hello, hi, myself Dr. Kavita. Today I'm going to talk about hypokalemia and its treatment. As we all know, the reduced level of potassium in our serum, which is less than 3.5 millimole per liter, is known as hypokalemia. So, what are the causes of hypokalemia? The first one can be because of its excessive excretion, insufficient intake, or can be because of intracellular shift of potassium. As we all know, the kidney plays the major role in excretion of a potassium with the help via urine. So, if any patient is taking any kind of a diuretic medication, that means his kidney will produce lot of urine, and with the urine potassium will be excreted outside of our body. The same way in our gut also, the potassium is excreted with the help of stool. So if the patient is taking laxative, or if the patient develops diarrhea, the excess amount of potassium will be lost with the stool. And the next one is because of excessive sweating. So if the patient is sweating a lot, again the potassium will be lost through that, and because of which the patient will develop hypokalemia. Last, as we all know, the patient who are having cancer, why cancers happen? Because if there is excessive formation of a cells growth, that means those cells for their activity they requires potassium. So the extracellular potassium will shift inside those cells, and the patient will land up in hypokalemia. So what are the symptoms of hypokalemia? The patient will come with the complaints of the muscle weakness, cramps, tremors, constipations, or paralytic ileus, or hypoventilation, that is a respiratory problem. So these are the symptoms because of which we can say the patient is a hypokalemia. And if you see the ECG of the hypokalemia patient you will observe their ECG having the patient is mostly in a tachycardia, but in between there will be the BPCs or APCs also. The mostly will be BPCs because the Purkinje fibers of the cardiac muscles are more sensitive to the potassium changes. So there will be BPCs, and there will be changes in the ECG. You will observe a prominent U wave, and the T wave will be inverted, or it can be ST depression can be present there. So these are the symptoms of a hypokalemia. Now what is the treatment of the hypokalemia? So the first one is the oral supplement, like you can give the Kesol syrup, but again if the patient is having the complaint of vomiting also, we can't give an oral supplement of potassium, or it will increase more of a vomiting. The next one is the IV KCL correction, in which you takes the each ampule of a potassium, it contains 10 ml of potassium. So you dilute whether if the patient's EF function of the heart is good, so you give directly in a 500 ml of NS, or else you have to give it in a slow syringe pump. So you have to dilute it with NS, and accordingly you have to give, because if you give the potassium very fastly, the patient will complain of a burning sensation in their veins. So yeah, these are the symptoms of the potassium of hypokalemia and their treatment. Thank you.